Live, everyone. Each year, more than 800,000 Americans have a knee replacement.
A knee replacement can relieve pain, allow you to be more active. Joining us today to talk more about this, Dr. Joseph Conflitti with the East Texas Medical Center Orthopedic Institute. Nice to have you back as always,
Thank you.
Doctor.
Appreciate it.
And you brought props. We love props here.
Yeah,
Tell us what you have here, Doctor.
Well, I brought two different things. This is an example of what we would consider our standard total knee replacement. Okay. It involves replacing the femur and the tibia with our standard implant, metal, and then in between is plastic. What I wanted to talk about today is we have a new way of putting this in, and that involves what's called patient-specific instrumentation. So if we focus on what the knee would look like here, through a series of tests, we can then manufacture this custom jig and then make a bone cut here on the femur, and you can see from the side how nicely it will fit on, and it's specific for the patient such that the implant then fits on very nicely and very perfectly, and you can see there also. And by doing that, then we can make sure that the alignment is great. If the alignment is perfect, then this standard knee implant here will last a long time.
Well, all knees are not the same, right? So it's obviously to have something custom fit just certainly sounds better anyway.
That's correct. And we do that by doing some tests in advance. We do either an MRI or a CT scan, and then this custom jig is molded and made and sent to us, and then we use that in the operating room to make those cuts.
And it being customizable to the patient, what is the recovery rate on a customizable knee replacement like that one?
Well, really the rate of healing is the same. It's about 6 weeks, and we usually have the patient in the hospital for a few days. They go through extensive rehab. Our goal is to make sure that if the alignment is right, then the patient's function is going to be much better. They're going to have less pain. They're going to be able to get back to their activities much quicker and have a more successful implant.
Well, yeah, obviously, again, customizing is just better. It's just better for everything that we do.
Right.
Where do you see this? I mean, you're a relatively young man. Now you've certainly seen implants. They've come light years in just a little amount of time. Where do you see this in the next 5 years, 6 years, 10 years?
I think this is going to be the wave of the future because we have all the technology already there with the MRI. We have a very nice implant, and the companies every year are coming out with better and better technologies to make this implant better. But where we've been lacking is making it specific for the patient. And if we can do that, and their ligaments are functioning well, the implant has great range of motion, I think it's going to be a huge difference for patients.
Now, we've heard about the advantages of the patient-specific knee replacement, but are there any disadvantages that we should know about?
Well, they're not for everybody. If someone can't get into an MRI, obviously we can't do that. Right. Sometimes if the deformity is very bad, that may also impair us from making a nice jig like this. There are other techniques that we can use in that circumstance, though, too. So,
where do we find out more on this, Doctor? Where can we go? If someone's seeing this at home going, I'd like to know more about this. What do we do?
Well, if you do have knee pain and do have arthritis, I'd be happy to visit with you in the clinic. We can go over the options, and if it's good for you, then maybe we can do that.
No need living with pain if you don't have to.
Absolutely.
Well, definitely not.
Joseph Conflitti, always great to see you.
Thank you.
And thank you for bringing your props.
Oh, every time.
Nice to see you.
All right.